Good morning, everyone. Happy Friday. Welcome to another edition of PT on Ice Daily Show. My name is Jason London. I am with the with Endurance Athlete Division and teach both rehabilitation of the injured runner live, rehabilitation of the injured runner online, and professional bike fitting. So happy to be with you guys today and wanted to talk about stress fractures and a risk factor associated with stress fractures that we may not always think of. So meds or medications as a risk for stress fracture and how those can change the ecosystem or our ecosystem when it comes to bone metabolism and make someone more susceptible to a stress fracture. But before I dive into that, just a few upcoming courses. We hosted here in Bozeman the extremity course this past weekend. It's an awesome course. If you haven't been able to check it out, there are a few offerings yet before the end of the year with both Mark and Lindsay. I think Lindsay will be in Fort Collins or Windsor tomorrow, so check that out if the weather's not great in Colorado or you're looking for a great course before the end of the year. And then also, as far as the Endurance Athlete Division is concerned, we have one more live course before the end of 2022, and that is going to be taught by Dr. Megan Peach down in Golden, Colorado, next weekend. And I do think there are some spots still available, and the clinic that it's at is an amazing clinic. I did the bike fitting course there 2 falls ago, and it should be a really good time. So head on over to ptonice.com to get signed up or find out more about those courses. All right, so diving into medications as a risk factor for stress fracture and how that works. So, our as we all know as PTs, the human body is an amazing piece of work. It adapts to the stresses put on it, and running is no different. Running is a sport of repetition and repetitive stress, and we really rely on that stress to signal to our bones to get stronger. So typically in bone metabolism, we have the stress of running that creates stress on the bone and a little bit of a stress reaction, maybe some micro damage. Our osteoclasts come in and help clean some of that up, and then our osteoblasts come in and lay down new bone, and then that bone actually becomes stronger due to the stresses put on it. That's Wolff's Law, and that is a very simplistic view of bone metabolism. And that's if our body's ecosystem or environment is functioning well. So there's certain things that can cause that ecosystem to get out of balance, and one of those things is medication. So looking at the literature, there's several medications that can interfere with that balance. If someone is getting or has gotten treatment for cancer through radiation therapy or high doses of methotrexate, that really can cause damage to the bone itself, as well as decrease the ability of the osteoblasts or decrease osteoblast activation. So therefore the osteoclasts are more active, and you're getting more breakdown of bone than you are getting building of bone. With antiretrovirals, so if you have a patient who has HIV and is getting treatment for that, those increase osteoclast activity. So basically causing, again, that imbalance where their bone is breaking down. There are many studies showing patients with that HIV on antiretrovirals have lower bone mineral density because of that. And anticonvulsants are another category, which again decrease osteoblast activity, and therefore the body the body's ability to lay down new bone and the stresses to it. And then there's two other categories that I think are maybe a little bit more common, particularly in our community here. And the first one is glucocorticoids. And so glucocorticoids are given for a wide variety of reasons, but really to decrease inflammation. So this example of a glucocorticoid is prednisone. We have patients who are getting prednisone dose pack to really calm down systemic inflammation. We have patients who are on prednisone long term for autoimmune disease. And what glucocorticoids do, or prednisone does, is it actually decreases the body's ability to absorb calcium in the gut. So one of the building blocks of for bone health is not available. And then it also decreases osteoblast activity at the same time, while increasing osteoclast activity. So again, that cycle or that bone metabolism is out of whack. And at the end here, I'll talk about a recent case study of a patient who's on glucocorticoids and developed a stress fracture. But before I dive into that, the last one, where it's most recent evidence, is NSAIDs. So non-steroidal anti-inflammatories. Those are not prescription medications, as you all know, and are taken ubiquitously by a lot of athletes to help combat pain. But what non-steroidal anti-inflammatories do is they really interfere with prostaglandins, which are really important signalers for mechanical induced bone growth or bone metabolism. So exactly what we're doing when we're exercising, and in this case running too. And by inhibiting that ability, it doesn't allow the bone to adapt. So there's been multiple studies on this recently, with the ones that a lot of them in the military, and Alyssa Fedge in 2022 or 2020 showed that those in the military who developed stress fractures were more likely to have been taking NSAIDs and have delayed union or delayed healing of their bone stress injury if they're on NSAIDs. And then Hodges et al. Further did a more robust study showing that those military population, those that were taking non-steroidal anti-inflammatories, particularly when it's a high training volume or high training cycle, had a 5-time increased risk of developing a stress fracture. So, really what the point of today's PT on Ice is to highlight the importance of making sure that we're covering the medications that our patients are on, and not forgetting to cover non-prescription medications. So I know for me, in PT school, when I was in my internships, before every eval that I had, if I had the information, I'd be looking up all the medications and seeing what the side effects were and how that might interfere with someone's rehab, or after the eval was done, looking all those up. And then as my career has progressed and things have gotten busier and busier and not having as much time, I've probably slacked on that a little bit. We're definitely cover the prescription medications that a patient is on, take a look at the list, sometimes recognize the medications, sometimes don't, but then move on. And what we really should be doing is kind of getting back to that PT school mindset, where we're looking at the list and then going through that list with the patient and asking them why they're on it. And then if you're unfamiliar with that medication, doing a quick Google search on that medication, where you'll find side effects right away and see if that's going to cause you to change your plan of care or just how you're going to progress their exercise. With the case of stress fractures, where that might lend you some information is if you have someone who's coming in with running-related pain where their volume is really low. And that's just what happened the other week. So I had a 40-year-old female who came in with hip pain to the point that she was limping. No real significant event other than that her daughter had been started cross-country running in middle school this past fall. So she had run on a couple of those practices, which were less than 2 miles, developed some hip pain, then went on a 10-mile hike, and the hip pain became a lot more severe to the point where her hip was painful with all weight-bearing activities. Now, if we're looking at the volume that she was doing, it was really low, right? Just a couple 2-mile runs and a 10-mile hike. Not typically what we would think of someone developing a stress fracture. But further investigation or questioning is that she did have autoimmune disease and had been on prednisone long-term or glucocorticoids. So with exam, that hip was irritable, but the most irritable thing was weight bearing. So sent her over to urgent care, where they started off with doing a radiograph, and actually to find that not only was it a stress fracture, it had progressed to a full-blown fracture. They didn't let her leave urgent care and had her transported to the hospital, where she actually had to get it pinned and a rod put in because of how unstable that fracture was. So that definitely was caused me to pause and really making sure that, hey, looking at and reviewing someone's medications is really important before we're going through with their plan of care, and helps paint a better picture of potentially why that patient's symptoms are present and what the underlying diagnosis is. So as a recap, really looking at medications that can influence bone health, particularly when we're talking about runners here, and the high prevalence of stress fractures just in a healthy running population. And those medications will be radiation for cancer treatments, or high doses of methotrexate, antiretrovirals for those patients that have HIV and are getting antiretrovirals as a treatment for that, anticonvulsants, and then glucocorticoids and nonsteroidal anti-inflammatories. So tuck that away, and next week for all your evals, try to really go through and make sure you have a good understanding of what medications they're on and how that might influence their care or your decision making, and when you're trying to come up with a working diagnosis. All right, thanks for your attention this morning. Everyone have a wonderful weekend, and get outside and do something fun.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review, and be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.